exercise is called passive pronation. Pronation is movement of the forearm with the palm moving in a direction towards the floor. Passive means that your arm is not doing the work, but instead an external force, such as your other arm, is helping to move your arm into that position. There's two important things to remember about this exercise. The first is that your elbow must be tucked into the side, and the second is the position of your hand. With your elbow tucked into your side and at 90 degrees, you're going to place your hand across the palm and the forearm. You don't want to grasp onto your fingers, as this torques your fingers and doesn't give adequate rotation to the wrist. Hold along the side similar to this, and now with your elbow tucked in, rotate your palm towards the floor. Hold for 5 seconds. Return to a neutral position, relax, and then repeat. If you find this is awkward for you, you can also grasp around this way and continue so that the palm is facing towards the floor. Again, it's important to keep your elbow tucked and not let your elbow come out to the side, as then rotation is occurring at your shoulder and not at your forearm. You can also perform passive pronation with a hammer. If your therapist has asked you to do the hammer exercise, you can follow these steps. Grasp the head of the hammer close to the hammer head. This makes the exercise easy. What you will do, keeping your elbow flexed in and tucked into your side, is you will allow the weight of the hammer head to pull your hand down so that your palm is facing the ground. You'll then hold for 5 seconds. Take the weight of the hammer off, return to a neutral position, relax, and then repeat. If you want to progress this exercise, you can move your hand down the shaft of the hammer towards the base. The farther you move down, the more difficult it will be. Again, hold your same position with your elbow tucked in at your side and allow the weight of the hammer to pull or rotate your arm over so that your palm is facing the floor. Follow your same 5-second interval. Relax and take the weight off, and then repeat. Again, you want to make sure that your elbow stays tucked in at your side and doesn't move out. If it moves out, you're rotating at your shoulder and not at your forearm.